Hello, I'm Principal Lecturer Eija Metsälä, and I'm giving you a lecture about different types of literature reviews. Contents of my presentation: different types of literature reviews, then some acronym by which one can construct a search question, developing search protocol, databases, assessing quality and levels of evidence, and summarizing and presenting data. There are different types of systematic reviews. In integrative reviews, we can include studies with all types of methodologies and designs. In systematic reviews, we can include quantitative studies with some specifically selected designs. The difference in between systematized reviews and integrative and systematic ones is that only one person can do a systemized review, and all types of methodologies and designs can be accepted. Scoping reviews are the kind of types where some maybe a wide topic will be inspected by reviewing what do we overall know about that particular topic, and we can include and map all types of available evidence like research studies, different types of reviews, and expert opinions, guidelines. So scoping reviews allows taking in various types of written materials. But still the process is systematic. Narrative reviews are the kinds that are not in fact systematic reviews. Selecting articles to be included into the reviews happens with more or less a systematic process, and the process is not necessarily very rigorously documented as in all the previous types of reviews mentioned above. Here are the main differences between different types of reviews. A review protocol is needed all but in traditional narrative type of reviews. Only one reviewer can perform scoping and systematized reviews, or of course traditional narrative reviews. In all systematic review types, there must be explicit, transparent, peer-reviewed search strategy, and that in fact differentiates traditional narrative reviews from systematic review, different systematic review types. As a demand of the previous one, in all systematic reviews there will be standardized data extraction form where we step by step document the search process. In systematized reviews, integrative reviews, and through systematic reviews, critical appraisal of the selected studies is mandatory. However, also in scoping reviews, this is often performed in order to make the search process more reliable and the outcome more reliable. So it's not mandatory but recommended also in scoping reviews. Also, synthesis of findings from individual studies and generation of summary findings is mandatory in systematized, integrative, and systematic reviews, but also recommended in scoping reviews, not mandatory, but recommended. It often helps to get a good idea of of the summary of the results also in scoping reviews. In scoping reviews, often like mapping is used to summarize the results. Systematic review process proceeds, of course, from the need of systematic information for the basis of, for example, some development project or even some further studies or even from some from the clinical needs, or there can be different types of product development process, and based on that need we start with formulating the search question, after which we go to the selected databases to identify, to find out the literature with rigorous search methods. We can also use other but databases. We talk about this a little bit later on during this lecture. Then we assess or evaluate the quality of the literature found, and then make the final selections of the studies to be selected for the review. And then after selection process, we summarize the data found from the search process. And then, of course, our purpose is to apply the evidence found for the purpose we defined on step 1. Firstly, we need to, or after recognizing the need, we need to formulate the search question. And the benefit of formulating the search question with some kind of acronym-based system is that out of these letters, acronym parts, we can then later on find the first search terms for our systematic search. I think the very first model, acronym model, to define systematic search questions was PICO, the acronym coming out of P meaning patient group or population, I meaning intervention or clinical situation, C control or comparison group, and outcome O. Here is an example. For pediatric patients from 6 to 15 years, obviously this is P, patient or population group. Is music or medicine X better to relieve anxiety? Here music is an intervention, medicine X would be a control, and what we aim to achieve by this intervention and control would be relieving anxiety. That obviously is the outcome we are looking after. There are also some variations out of this so-called big PICO, little PICO, where P is for patient or patient group, I for intervention, and CO for context. So we don't have comparator there. And PCC for population, concept, and context. These both are typically used when we search for descriptive and qualitative studies. There are several other acronym-based ways of constructing search question that you might find from the literature, but I think these are also PO, where we have P for patient or patient group, I for intervention, and O for contexts is often used. Then, as I already told, we often use this acronym-based model and its component to identify our first search term. So out of those components of the acronym, we of course use them as such, then try to figure out synonyms for them, and which I recommend you would be to use the services of your library staff and ask for them to search for so-called mesh terms, which are used in many databases, respective to components of your PICO or PO or whatever acronym you may use in defining your search question. Then, after we have defined a search question, we need to prepare our inclusion and exclusion criteria. What kind of studies we want to include, what studies we exclude. These also we can start with creating out of the acronym we created. Also, into the inclusion-exclusion criteria, we can define study designs and the time period we are searching for the studies for. And it is a good question, what is a good time period for searching for studies and putting the time period into inclusion and exclusion criteria. The response depends on the topic. For example, if our search is about for people's attitudes or something that changes very seldomly. For example, if I did a search about people's some studies about people's health beliefs. I could take a little longer time period because beliefs are such that change very, very slowly. Instead, if I did a systematic search about some health technological devices, I would take quite not many years period during out of which I would search for the studies, because health technology is the kind that changes already in a few years very much, and then the studies found from a long period of time would not be comparable. So how long time period we should take depends on the topic. As presented in the one of the very first slides, one can make a systematized review or scoping review on one's own, but for other types of systematic reviews, one needs more, at least 2 independent reviewers to confirm the search process and exclude the search bias. And often kappa index, or at least agreement percentage between different reviews in the different stages of search process is calculated. Not mandatory, but it's easy to do and tells something about how well the different reviewers did agree in this search process. In addition to electronic databases, you can also search reference lists of the relevant articles. What I personally do is that when I were pretty much in the initiation stage of my review, when I find one good article with perfectly matches my inclusion and exclusion criteria, and out of which I think that this really responds my search question, I look at the keywords of that one and also try them in my search, and also look at the reference list of that particular article and see if there would be good articles for my search. This is called so-called hand search, and that's really recommendable to do. But remember that also the articles found from the reference lists and by other means, they must obey inclusion and exclusion criteria as well. You just report them as so-called hand search outcomes. Volumes of relevant journals published just as hard copies, you can use them for hand search. Congress abstract books, doctoral theses. There's also doctoral dissertation databases, which you can of course use and document them, their search process as any from any database. Also, nowadays, in many databases, there is a list of citing articles, of that article, and that is also a very good way of finding more relevant articles. Here, just to mention some open access healthcare databases which you can access anywhere for free. If you happen to be on the kind of location that you have no access, for example, to your university's databases, or for some other reason you are not able to use so-called closed databases for which you need to have some kind of licenses. These are free to use. I'm not going to talk about them a lot, but just to mention that OATD is a database for doctoral dissertations and theses. If you only want to use doctoral dissertations, which I recommend for systematic reviews, there's an option to select them out of bachelor thesis and everything, bachelor and master thesis, which are not that recommendable for systematic reviews to use. Agency for Healthcare Research and Quality is, especially if your topic is about quality of services or some products, or there you might find useful information. PubMed, I suppose many of us already know. Epistemonikos is quite a new healthcare database, which is also open access, and according to my experience is quite nice one. Here are some more databases for which you need a license, for example via your own university or educational institution or hospital. So they, in order to get full text out of these databases, you need to pay or then use the license of your own institution. Some health technology assessment databases, if your topic is about health technology. Some of these are for free, and for some at least you need to log in to create an account. But just check them out, and for you to know that there are also this kind where there is summarized knowledge about the quality of different health technologies collected. Next, I advise you how to proceed into your search process and how to document the search process. For simplicity's sake, I use just keywords breast cancer and detection and detection. And databases PubMed, and ScienceDirect. As you can see, this tool is not very handy. We start with putting these two simple keywords into PubMed databases and find out that there we get 500 titles out of PubMed. Then we put the very same keywords to ScienceDirect database and get 500 more. It could be something else, but let's play. We get 500 titles out of both databases. Then we find out that there are many same articles coming out of these both databases. We call them duplicates, and we don't want to have same articles double. And let's say that we find out that there are 100 same articles on these both databases, and we delete them. We leave them only once into the search process. That leaves us 900 articles in total after removing duplicates. Okay, then we start reading the 900 articles just by just the titles, nothing else but titles, and see by using our inclusion and exclusion criteria and our common sense if these articles speak about our topics. Okay, out of those 900 ones, we think that maybe 400 speaks really about our topic. Then we read these 400 at abstract level. And find out that out of those, having read those 400 abstract, it seems that 150 seem to speak about our topic, or they otherwise go, oh, sorry, not 150 seems to would be excluded. We document those 150 in here, meaning that we exclude 350, 250. Sorry, my bad calculation. Yeah, we exclude 250 at this stage and leave 150. At abstract level, we can, when we read those few lines abstract, we may find that for some reason those articles do not fit into our inclusion or exclusion criteria. They simply don't speak about our topic, or the study design is wrong, or there might be, for example, such just search protocols, not at all studies, or some might be review papers which we might not want to take if we have so defined in our inclusion or exclusion criteria. It often happens that the amounts decreasing are something like this. And okay, now let's play. This is truly really imaginary study. We get 150 the kind of articles that seem to be the kind that we would like to read at full text level. Okay, we start reading them at full text level. We may be doing that alone, or there might be a bigger group. This is quite a big amount, in fact, but we are eager to do this, and we read those 150 articles and find out that, oh no, still there was a lot of articles that really don't fit our inclusion and exclusion criteria based on reading those 150 full text. In fact, there was over half of them not fitting into. There was 90 articles that really, based on full text, didn't fit into our inclusion and exclusion criteria, which leaves us 60 articles to be assessed for eligibility, and for which we do the quality assessment. For example, there are different types of quality assessment criteria, which I will be presenting you in the next slide. Based on certain criteria, we will assess the quality of the selected studies, and as we have this much full text left at this stage, we can put the criteria quite high, that we only want to select the best quality studies, and we exclude again most of these based on bad quality, and we are left, let's say, 30 articles. We exclude 30 and include 30 articles to our final review. And as you can see, we have documented the search process very rigorously during all the way, and even the reasons for exclusion we document here into this figure very rigorously. There can be various reasons. For example, the topic was not right, the study didn't really speak about my topic, the design was wrong, or the overall quality just was that bad that we couldn't take it in. We don't want to take bad quality studies. We want to base our decisions and summary at the best quality studies. So I hope you got some kind of idea of the selection process based on this slide. Now we go to the topic of assessing the literature, assessing the quality. Here you can see a sophisticated explanation what bias is all about. But to put it into a layman's language, it refers into the quality of studies. If the whole process of that particular study has been rigorously executed and results reliably reported. As I mentioned to you, we only want to base our decision on best level evidence. And what is best quality evidence? There are different criteria for quantitative and qualitative studies. As highest level of evidence in quantitative studies represent systematic reviews and randomized controlled trials because sources of bias have been excluded there by using controlled circumstances, and comparisons are made in different directions in RCTs. Second best evidence present cohort studies, then case control studies. Third best cross-sectional studies. Fifth best case series and case reports. And a lowest level of evidence, expert opinions without explicit critical appraisal or this kind of clinical studies, small-scale clinical studies, which are pretty common in medicine. Qualitative studies levels of evidence are assessed by totally different criteria. Highest level of evidence presenting generalizable theoretical studies. Second level evidence presented conceptual studies where, for example, associations of different concepts are studies with the rigorous methods. Third level of evidence present descriptive studies, qualitative descriptive studies. And fourth level of evidence present descriptive single case studies. Now let's go back to the quality assessment. There are different types of checklists for assessing studies with different types of methodologies and designs, and note that you can't assess the quality of the selected studies all with the same kind of criteria. There's one exception, method with which you can, I will present it soon, but if you, for example, use John Briggs Institute's checklist, you need to select a dedicated checklist for studies with different designs. This is the one method by which you can, by using which you can only use this one checklist for all the studies, because this is this kind of 10-step checklist where you just document how well these 10 criteria apply for different types of studies. The benefit of this list is that you can put this as an enclosure or even inside an article, and then the reviewers can themselves compare the quality of different studies. But what the con and the limitation of this method is that the special features of different research design do not come up clearly by using this checklist and some criteria mentioned here do not apply to all types of studies. For example, criterion 5, independent and dependent variables and confounders are clearly identified. That doesn't apply to qualitative studies nor to systematic reviews. Then you just need to mark there that in the case of qualitative or systematic reviews, that criterion does not apply. So it kind of make the assessment a bit less valid, but the benefit is that the reader can directly see the quality, since in using checklist, especially if you report your review as an article, you can't describe the assessment very in detail with the checklists or even in the text, because of the small space booked for that in the article. Maybe if you have a large report, for example, thesis report, you can write more there about the quality assessment of different studies, even if you use checklists. But yeah, there are pros and cons in using different methods. Then, to summarizing the data, I think most often you use summarizing a qualitative summary. Here is an example of article where this quality of qualitative summary was used. Maybe you can check that out. It's an open access article. So you simply kind of use the results parts of the article as if they were any kind of qualitative data, and can do some kind of thematization or mapping out of the results. You also map or tabulate the articles and describe the articles by this kind of tabulation. Please check out on your own this article and look at the tables and figures, how the results were summarized based on qualitative summary. This is the kind of table for tabulation, example table you can find on that particular article also. Meta-analysis means combining result of studies statistically. In order to do this, make sure that questions posed on the separate studies you summarize are exactly similarly posed, and also that the population on those separate studies was equal kind enough, so that you don't end up summarizing like peas and potatoes, calculating together, summarizing together things that are different kinds, results that that are actually responses to different kinds of questions, or produced out of different types of populations, so that the data out of different studies you summarize really are similar. Yes. So I would be really careful in using meta-analysis. That is possible and fits very well into if you have quantitative studies which you want to summarize together, but make sure that you are summarizing results of studies that are similar by their research questions and population groups. Then, of course, we want to use our evidence to solve the problem for which we had created our systematic review for. Here are some references. Thank you for your interest, and hope that this brief lecture gave you an idea of what systematic reviews are all about. Thank you.